चेन्नई के अपोलो हॉस्पिटल के वरिष्ठ एवं देश के जाने माने सर्जन डॉक्टर जे.के. जमील ने एक प्रेस कॉन्फ्रेंस के माध्यम से विंडोस्कोपी सर्जरी, एंडोस्कोपिक सर्जरी और रोबोटिक सर्जरी के बीच अंतर की विस्तार से जानकारी दी। डॉक्टर जमील ने बताया कि विंडोस्कोपी सर्जरी में छोटे चीरे के माध्यम से कैमरा और विशेष उपकरणों की मदद से ऑपरेशन किया जाता है, जिससे मरीज को कम दर्द, कम रक्तस्राव और जल्दी रिकवरी का लाभ मिलता है। ये तकनीक वर्षों से सफलतापूर्वक अपनाई जा रही है। वहीं रोबोटिक सर्जरी आधुनिक चिकित्सा तकनीक का उन्नत रूप है, जिसमें सर्जन रोबोटिक आर्म्स की सहायता से अत्यंत सटीकता के साथ जटिल ऑपरेशन करते हैं। इसमें 3D विजन, बेहतर नियंत्रण और अधिक सटीक मूवमेंट की सुविधा मिलती है, जिससे जटिल सर्जरी भी सुरक्षित और प्रभावी हो जाती है। डॉक्टर जमील ने कहा कि दोनों तकनीकों का चयन मरीज की स्थिति, बीमारी की जटिलता और चिकित्सकीय आवश्यकता पर निर्भर करता है। सही तकनीक का चुनाव उपचार को अधिक सुरक्षित और सफल बनाता है। प्रेस कॉन्फ्रेंस के दौरान मीडिया के सवालों का जवाब देते हुए उन्होंने आधुनिक सर्जरी में तकनीक की बढ़ती भूमिका और भविष्य की संभावनाओं पर भी प्रकाश डाला।
Jamil, I'm a surgical gastroenterologist, laparoscopic surgeon and robotic surgeon at Apollo Hospitals in Greens Road in Chennai. I'm also an adjunct professor with the Apollo Hospital Education and Research Foundation and an adjunct professor at the Tamil Nadu Dr. MGR Medical University. I'm currently the International Surgical Ambassador for the Royal College of Surgeons of Edinburgh, UK in India. I trained and worked in the UK for almost 14 years. I was a consultant surgeon in the National Health Service before deciding to come back and relocate in my hometown of Chennai in India in the year 2013 and been practicing in Apollo hospitals ever since. I deal with a wide variety of gastrointestinal disorders. I'm a surgeon, so I offer surgical cure for patients with gastrointestinal problems, and I offer open surgery, laparoscopic surgery, and robotic surgery depending on the indications.
So, what are
Robotic surgery is an evolution in minimal access surgery. There was laparoscopic surgery, which came as a new technique some 4 or 5 decades ago. Both robotic surgery and laparoscopic surgery come under the title of minimal access surgery. So basically, instead of making a big hole in the abdomen and performing the operation, when we make small, instead of making a big cut in the abdomen and doing an operation, if we make small holes and perform exactly the same operation, we call it as minimal access surgery. And this minimal access surgery was being performed by the laparoscopic approach for about 4 decades now, 4 or 5 decades. And what basically it means is introducing long slender instruments. The surgeon stands by the patient's bedside and introduces a camera through one of the holes and watches the abdominal the disease inside on the monitor and does the operation. That was laparoscopic surgery. With robotic surgery, through the same kind of holes, the surgeon introduces robotic instruments, and these robotic instruments are quite different from laparoscopic instruments. They have a better dexterity, they have better movements. In fact, we say they have 7 degrees of freedom in their movements, so they almost mimic a human wrist. In fact, there's another name for robotic instruments, it's called endowrists. So these instruments are placed inside the patient's abdomen, and the surgeon controls these instruments by using the surgeon controls, the master controllers in the surgeon console. So every movement that happens inside the abdominal cavity by the robotic instruments is controlled by the surgeon in the surgeon console. So the surgeon is fully in charge of what is actually happening inside, and by doing this operation using these robotic instruments, the surgeon is able to perform the operation in a more precise way. The robotic cameras are much better. We get better magnification, we get more clarity, we even get a three-dimensional view, and therefore we are able to see better. And because we are seeing better, we are able to operate with more precision. And because of more precision, there is less blood loss. And therefore, there are lots of studies which have shown that patients with robotic surgery tend to have a faster recovery. There's almost little or no requirement for any blood transfusion. They get back to work early, and in certain certain cancers within the gastrointestinal system, there's been studies which have shown that robotic surgery provides a better level of cancer clearance and a higher level of lymph node harvest that goes along with the cancer surgery, and that translates into less chances of cancer recurrence and better overall survival.